Hello, and thank you for joining us tonight for our free webinar, Practical Auriculotherapy, featuring Marie-France Collin. My name is Jeff Bloom, Education Marketing Manager here at L.AC OMS. For over 40 years, L.AC OMS has been striving to promote the growth of the acupuncture industry by providing quality products, great prices, and the best customer service, as well as supporting the many schools and continuing education efforts available. With our free webinar series, we intend to provide free educational opportunities taught by some of our industry's most renowned practitioners and educators. I would like to take a moment to acclimate you to the webinar room. To the right of the video screen, you will see 3 tabs: Chat, Questions, and Polls. To chat with other attendees or to communicate any technical difficulties, please use the Chat tab. For questions of our guest speaker, please make sure to use the Questions tab, and we'll answer those at the end of the lecture. We also posted a few polls tonight and would appreciate if you took a moment to answer them. Please note that each webinar is recorded, and immediately following the conclusion, you will all receive a link with an email with a link to view the video on demand and a copy of the slides. You may always visit our blog and use the free webinar tag to find all of our previously recorded events. From neuroscience to sports acupuncture to Chinese herbs, you'll find something interesting for every practitioner on the L.AC OMS blog. Now for our featured speaker. Marie-France is a licensed acupuncturist in the state of Illinois and California. She started studying acupuncture in Japan and China, then followed skilled acupuncturists in their practice in both the USA and France before attending school in California. She currently teaches acupuncture and auriculotherapy in Chicago at Pacific College. Her knowledge of auriculotherapy stems from Dr. Nadia Wolf, who taught her how to use the ear for diagnosis and integrate it into body acupuncture with Dr. Raphael Nogier and colleagues who continue the lineage of Dr. Paul Nogier. These are 2 different systems that she continues to explore. Please join me in welcoming Marie-France.
Thank you, Mr. Jeffrey. So good evening, everyone. So we'll start with your first slide. Let me, okay. So before we go into talking about the diagnosis, let's talk about the brief history of auriculotherapy, which has gathered from a couple of books. So apparently it's not very new. In Greece already we had 2 doctors, Hippocrates and Galen, who use the ear. We have, what's going to be interesting to see is for what condition they use the ear. Through the ages, like for the last 2,000 years, more or less. A lot of for sexual problems and for sciatica, we'll see. So Hippocrates recommended small incision in the capillaries on the posterior side of the ear to treat premature ejaculation or impotence, low back pain and the leg. And then we have Galen, who also did scarification of the posterior ear, and also cauterization for sciatica and sexual problems. We know that from medical texts from the late Roman Empire. And then after Greece, we have Egypt, Ptolemy IV. There was a discovery by French archaeologists. They found papyrus, I don't know how you pronounce that, recording auricular points. So they found on mummies, tattoos of mummies, they showing that they were using the ear for menstrual problem and sexual problems again. And then we go to Persia. Avicenna, one of the very famous doctor who wrote the complete canon of medicine in 1025 over a century. He's the one who talked about the piercing the earlobe, you know, the ear point. In fact, the eye point we're going to see later on. So the pirates were using it to allow them to have a better vision. And it's in the area now we do the piercing when we have earrings. Then we go to Portugal. We move up to Europe. So a doctor called Zacutus Lusitanus in the 1500s. He was the first European to describe and recommend, again, scarification of the ear. Then we have Italy. We go to Italy. Let me see. Yeah. Again, so Portugal was for sciatica. In Italy, Antonio Mario Valsalva in the 1600s described the ear point and their location. He published a book called The Treatise on the Human Ear. And he was explaining how to treat toothache, again, by doing a scarification on the earlobe. And now we know the teeth are going to be located on the lobe. Ignacio Colla, another Italian, he published a paper about a man who couldn't walk due to very bad pain in his legs. And one day he was stung by a bee on the ear and he was able to walk again. And in fact, the point location where the bee stung him was on the leg. So on the antihelix, when again we are going to learn that all the antihelix superior cruise is the legs are located, the leg points are located. And report as well successful cauterization on the posterior ear by one of his colleagues for sciatica. So again, we have sexual problems, we have sciatica, we started seeing eye disorders and tooth and teeth disorders for the first 1,000 of years of our era. Then we go to France, to Joseph François Malgain, who was a member of academic medicine in the 1800s. He published a report on, again, sciatica. He observed cases of sciatica get treated by incision on the posterior ear again, and out of 13 patients, 12 were cured. So that's a huge, even though the sample population is small, it's a huge success. And the other one was partly relieved. So, and he devised, it was said he devised the first diagram of the point corresponding to internal organs. Then, at the same time, in 1850, we have Dr. Rolker from Cincinnati and Dr. Luciani from Corsica, which is part of France, between France and it's on the eastern coast of Italy. If you don't know, southern in the Mediterranean Sea, that's where Napoleon was born. And from Corsica, he report cauterizing again the helix for sciatica. So the helix is the outer edge, the most outer part of the ear. So now that's going to be different area, because when we saw sciatica before, it was on the posterior ear, not on the helix. So now we have a different location again for sciatica. So then we had a lot of publications between 1850, 1857 on that subject. And this treatment became very popular in France, but then it was abandoned for lack of scientific evidence. And then in the 1951, we have Dr. Paul Nogier. I'm sure, I think many people who do acupuncture auriculotherapies, they know of Dr. Nogier. So Paul Nogier was a medical doctor. I think he was in the military before, and he became a doctor. And he also learned acupuncture. He learned acupuncture with Dr. Niboyer, who was a student of what's his name? The person who de Morand, Soulier de Morand. Yeah, you may not recognize his French name, but he's the one who wrote a big book, a big thick red book about acupuncture, which is basically more or less a translation of the chapters of the Jundio Tachang, the Great Compendium of Acupuncture, written in 1601. And Soulier de Morand was not a doctor, he was a diplomat. In the late 1800s, he went to China, he lived in China for several years, he learned Chinese language, and he learned acupuncture with doctors, with practitioners. And when he came back to France, I believe in the 1920s, he started teaching acupuncture to doctors. Yeah? And so this book now is translated in English, and it's a big, 1,000 pages. Maybe some of you are familiar with it. And then Dr. Niboyer, who taught acupuncture to Paul Nogier, was a direct student from Mr. Soulier de Morand. Yeah, so that's how we have acupuncture in France now since the early 1900s. But it was originally only for doctors. Nowadays, it's not only doctors. Like, I couldn't go back if I wanted to. If I want to resettle in France, suppose I don't like it here anymore, or whatever happened, I can always go back to my country, set shop. But the only thing is that I can treat people without being a doctor, but people will have to pay for their own pocket. That's the only difference. Yeah, we are not recognized by the medical system. So Dr. Nogier, therefore MD, in 1951, he was treating a new patient, and he noticed that that lady had a scar on the ear, and he asked what's going on, and she said she had seen like a healer who burned that part of the ear because she had sciatica, and just with the scarification, with burning the ear at that particular spot, the sciatica pain was totally gone. And then he said afterward he found more people with the same case. So he got intrigued, and he looked exactly at what point she had burned, she had cauterized, and he figured it was the point because he knows that the sciatic nerve comes out of lumbar 5. Yeah, so he figured that because everybody had the same the scarification in the same place, he figured that place should be L5. Therefore, it gave him the idea that the ear was corresponding to the inverted fetus, because otherwise the, I'm going to show you on that map here. Here. I don't know if you can see. Yeah. In any case, so then he decided that the L5 was in that position, and therefore the ear map corresponded to the inverted fetus with the with the legs, the spine, upper, the feet on the top, and the face on the bottom. So then, from then, of course, he started doing more research. And then, let me see, then he established a map. I think in 1957, he established the first map of auriculotherapy. And what else about Dr. Nogier? Yeah, and he says, because previously he knew what he found out all these, some of these previous doctors had treated sciatica by cauterizing the ear, excuse me, but on the posterior ear. And he said, let me see, okay, let me read what I translated here. I say, I suspected the ear related to other body areas, but all my trials were unsuccessful for a long time. I had a hint using manual medicine. Knowing how often L5 is blocked with sciatica, I thought this point must impact it directly. It's then that the idea of the fetus in utero position came to me. The back anatomy was reversed with lumbar higher, cervical lower. Little by little, I established the ear cartography by stimulating points one after another. Different types of pain were alleviated. In fact, I did not know then that the point cauterized was not at the same location as the century prior, and if I had tried the helix, I would never have discovered auriculotherapy. Okay, so that's so then after that we have the history in China. So we have some mention of the ear along the history. We know Sun Semia, which was one of our great doctor from the Tang Dynasty. He says in one of his texts, cauterize the transverse pila above auricular canal for jaundice and varices in cold and hot seasons, and cauterize yang wei point for tinnitus. And then in a book called the Weisheng Paojian, Health Treasure from 1281, they talk about the 5 zang, 6 fu, and 12 meridians. They say are all corrected with the auricle. Cauterize a small blue venule at the back of the ear, again, posterior ear, for treatment of infantile epilepsy. And then, of course, in the Ling Shu, they mention the ear, but they only say inspect the auricle to diagnose kidneys. It's not nothing very precise. We know that the kidneys in Chinese medicine correspond to the ear. They're supposed to be the same size, by the way. It will be interesting when we do autopsy to figure out, are really the ear the same size as a kidney in any particular person? That's what we learn. I don't know. Why not? And then in also Gerhung in the 400s, he talks about blowing the ear in a blowing blowing something in the ear for patient that was at the desk door. And then we have, okay, I didn't put everything on my slides. I have more on my paper here. So Yang Izhou is the doctor who compiled the Great Compendium of Acupuncture in 1601. The last big encyclopedia of acupuncture we have available. And he said, Cotera is the apex of the auricle to treat film in the eye like glaucoma. And then, and so also in rural China, they started using, again, the ear acupuncture, especially, I believe, when Mao Zedong came into power, he had developed, again, the acupuncture as opposed to Western medicine. And I believe they also looked at auriculotherapy in those times. So in 1956, there was a hospital in Shandong province, which is the birthplace of Confucius, by the way, on the eastern, below Beijing, but on the eastern side, on the Atlantic Ocean. So in Shandong Hospital, they obtained marked results for acute tonsillitis with ear acupuncture. And also, so then in 1956, Dr. Nogier published a paper, a scientific paper, demonstrating the relationship of the auricle and body parts. And it was translated in German first in 1957, and then it was translated from the German into Chinese in 1958. And then from then on, the Chinese have started using the Dr. Nogier map. And they say the flowers of acupuncture treatment are in full bloom everywhere in China. So they recognize Dr. Nogier from being what they call now the father of auriculotherapy, because it really took off from his discoveries. And then the first school of auriculotherapy was established in Shanghai using Dr. Nogier's map. And then also military doctors in China used auriculotherapy. And but then Dr. Nogier, and he trained quite a few doctors, students who are still teaching nowadays. In Lyon, I took classes with a couple of them. And so many doctors who were trained by him directly. So nowadays it's Dr. Raphael Nogier that takes over, because Paul Nogier died in 1991 or 96, I believe. And then Raphael Nogier is the one who continues on his path. He teaches classes in Lyon. He teaches classes. He comes to the US. He came to Maryland at the Johns Hopkins University, and I know he went also to 5 branches 2-3 years ago, and he went to San Diego the year after, and I know he wants to come back and to teach his system in the US whenever time are better, whenever we can move around again. And but again, Nogier's system is very specific. It's a system on its own. And it takes a long time to learn, because he has different phases, 1, 2, 3, for acute problem, for a chronic problem, and degenerative problems. Yeah? So I think we spent several years using his system, and then he has a way to detect the problem with the pulse, which is about a little complicated to really develop the feeling of the pulse, but it was very, very up to the point. It's very excellent. We spent, he says it takes about 6 months to really be good at the pulse. So that's called the VAS. Yeah. So again, it's a system on its own. So I started learning several years. I went to Dr. Nogier in Johns Hopkins, and then I went to Lyon 2 or 3 years in a row, because why not? They have excellent food in Lyon. So I like to go abroad for my seminars. Yeah. So I spent, because he teach 1 week at a time, beginner's level and then advanced level. So I went several times, and also with some of his doctors who teach a very particular aspect of the diagnosis, and so that's but I'm far from knowing his system as a whole. I can't use all of it yet. I can just, use for a few things, because now I have been in a different system with Dr. Wolf. Because Dr. Nogier is a medical doctor, he's not an acupuncturist. So when he treats, he has protocols to treat various diseases with only auriculotherapy. Yeah? So that's a specialty. My other teacher, Dr. Wolf, she's an acupuncturist as well as being an MD. And what she does, she's going to diagnose from the ear and treat with the body, treat with acupuncture. So that's a difference. But so in USA now we have probably the most famous person who does and teach auriculotherapy is Dr. Olson from Los Angeles. He has a book I'm sure everybody knows about. I think it's in every school. It's a big book, and he talks about Dr. Nogi style. He also talks about the Chinese style. And what's interesting is he conducted a double-blind study in 1980. He was looking for validating the location of ear points for joint pain, and with an accuracy of 75%. Yeah? And possibly the other 25% were because people were on medication. So if you're on medication, usually it will clear away the pain from the ear. The ear will not be sensitive, but the joint pain will be sensitive. Yeah? And also, it may have been a referred pain. It may not be the real pain coming from somewhere else, which we will expand upon. And then I think it's pretty much with the history. So then we have, maybe some of you have seen that picture. We have, it's a Dutch Hieronymus Bosch. We call it Jérôme Bosch in French. He painted a picture called the Garden of Earthly Delight, and with a lot of symbols. And so we have one, this part is supposed to be hell, yeah? And here we have a depiction of the two ears with, what you call an arrow going through the genitals area, yeah? The internal genitals, that's this area here. So in the 1500s, it means probably then in Holland, they must have been, they must have used auriculotherapy, or at least partly. So it's not new. Yeah? Food for thought. Now, why do we have ear? Yeah? Because not every species has ears. And only mammals, that's what I learned from Dr. Nogi, only mammals have ears. Yeah? And if the mammals are very, well, the more they are developed, the more their ears look like ours. So the chimpanzee is the species that has the closest ear to the human ear. And it's only cold-blood species do not have ears. Yeah, so only mammals, and with the species which regulate their body temperatures, like the snakes, they are cold-blooded species, they don't have ears. Yeah. So only the mammal that regulate their body temperature have ears. Therefore, it is so that the ear is not only for hearing, but also it must have some relationship with the regulation of temperature in the body. Yeah. It is said that, for example, I don't know if I have it on my slide. Yeah, no, not yet. For example, if you drop your hand in a very cold liquid, in very cold water, yeah, your body temperature ain't going to change. But only in the ear, only the area corresponding to the hand is going to be cold, not anywhere else. Yeah. So there is again a lot of research has to be done, and there is another French doctor who is doing research on a little mammal that live in Somalia that Dr. Nogi talks about. It's rat taupe nu. It's ra means rat, taupe is a mole. So it's like a species like half rat, half mole, and without fur. Yeah. So apparently it lives in tunnels that it digs itself in Somalia. It does not have ears, but it has an excellent hearing. Yeah, and something also special about this little animal is that it doesn't have the pea substance that we do have that going to allow us to feel pain. So this French doctor is with a team is working in a hospital. I think they are doing research now on this particular mammal to see what is it between, you know, what's very special with him and have excellent hearings and not having ears. Okay? And I have an article in French here that I don't know if it has been translated in English or not. And they talk about, again, there's somebody who did a whole research again on the thermography of the ear lobe, of the ear. Yeah. So, because lots have not been translated in English, right, from the Dr. Nogier people who work with auriculotherapy. Okay. Okay. Then, okay, food for thought. What are the ear for? Is it really, again, if some of you are researchers or research inclined, then that subject you can go into, maybe, you know, PhD program or something. If it's not only for hearing, does it really have a relationship with the regulation of our temperature? Then, now, let's see where I go to my slide. So we're mentioning the ear because, you know, in acupuncture, we have the pulse to diagnose, we have the tongue to diagnose, yeah? But the pulse is very subjective. Like how good are we at pulses? How many pulses are, you know, the Chinese, they say, once you have felt 10,000 pulses, you have an idea what the pulse is about. So how many patients, 10,000 visits to start have an idea of the pulses. And then if we don't go to hospitals, to various departments, it's really difficult to have a very clear understanding of the pulses, because in our clinic, we are not going to have somebody with massive blood loss, like in an emergency room, for example. So a lot of those 28 pulses, we are not going to be able to have a chance to find them. So, and it's very subjective. The tongue is objective because you can look at it. As long as everybody can see, you can see the tongue. But it's also going to change according, you know, to your digestive system and so on. And it's only specific to internal organs. The ear, the microsystem, you know, you also have the feet that people use reflexology, and you have the hand that people, you know, the Korean hand acupuncture. That also a microsystem that are going to be complementary to our acupuncture channels. But the ear is probably, I mean, surely the easiest to use, because you can't walk around with needles in your feet. You can't walk around in needle or you know, in your hands either. But I mean, you could walk around with needles in your feet if you use Spionex, maybe, but probably not very comfortable. Yeah. And I think the Korean, they use the what do you call aimant, I forgot the English name. The magnet. Yeah, they use magnets. So maybe you can have magnets on the dorsum of your hand, but it's probably difficult to keep having magnets with the inside of your hand if you want to work. So, and in China, they also do eye acupuncture. Yeah. When I was in Beijing, the family, I was staying with a family, and the Chinese nanny, she told me about a doctor who is very famous, because in Beijing, the only thing he was treating everything from the eyes. So for that Chinese, you know, they can take it, right? But I don't see ourselves here in the US treating all your body pain with point around the eyes. Yes. We are shy in using eye point, whether you be one, even stomach one. Yeah. So in any case, that being said, the ear is going to be the most convenient microsystem to use, either as a sole therapy or in conjunction with the body acupuncture. Okay. So now we are going to look at the changes in the ear. When we look, because if the ear if the body is totally healthy, there is no point showing up. There is no mark, there is no redness, there is no white, there is no scar, there is no brown spot, there is nothing. Yeah? It should be a blank slate. Like babies should be born with a total blank slate, no point. So it's auricular point, they only show up visually, like if they are red, it means they are going to be inflammation. Acute, if it's brown, is going to be usually chronic, or yeah, like a brown spot is something chronic. Yeah? If the lobe is red, usually it's going to be a sign of hypertension, because remember on the bottom of your ear, it's going to be the face and the head, the top of the head. If we have veins, it's going to indicate blood stagnation in a particular area, and many times we are going to see veins on the low back, on the sacrum, on the hip, on the knee, on the ankle, maybe on the elbow, on the wrist. I mean, on the ear location. Yeah, they are common site where we see vein crossing. Or in the thoracic area, we are going to see veins in the digestive, all the way from the gallbladder to the diaphragm, for example. You can see veins in the gynecology area, in the internal genitals. So veins are always going to be a sign of blood stagnation in the organ or in the area. Swellings, now we have edema. Yeah, we may have nodules. Yeah, scars. In that case, scars are going to indicate possibly operation that people had. So like my teacher, she's excellent. So she will tell people, oh, you had 2 children, or you had, of course, if she sees 2 scars in the gyneco area, it means either 2 children, maybe 1 miscarriage and 1 child, right? We don't know exactly, but there is something there. You can see scar. We are going to look at scar usually in the breast area, yeah, to see if there is a chance of that woman, without knowing, already has maybe a breast tumor or something like that. Yeah, we are going to look at deformation. Yeah, deformation usually on the helix, on the outer part of the ear. Deformation are going to, and unless they had a surgery, because some people have surgery because they have the ear too close, too far apart from their, from their skull. Or, but if it's not because of a surgery, if it's natural deformation, it's going to mean that the immune system is compromised. So we are going to see that in autoimmune disease. Or, desquamation, so usually that your little, like dandruff, but the dandruff are on the head, on the scalp, and those ones are going to be inside the ear. It's usually linked to hormonal disorders. And we say auricular points only show up visually or on palpation if an organ or body part is dysfunctional. Yeah. So if we are healthy, there is nothing. We should not see anything on the ear, or when we palpate, there should not be any pain. That's why we always have to palpate or to look at the ear. We cannot just put a needle anywhere without knowing what's going on, because it's not going to be efficient if there is no indication or no pain there. So, and the further along the process, the more developed the problem is, the larger the zone is going to be. Yeah? So if it's a small issue, it's going to be only on a small area corresponding to that organ, for example. And if it's a bigger issue, more severe, then the area is going to be expanded. Therefore, that's why it's difficult to establish exact mapping, because sometimes, for example, you have liver problem, they are going to overlap with the stomach area, for example. And so I know people are still working on establishing, a cartography. So Dr. Nogier is asking people around the world to if they want to present their cartography, whatever they found about the mapping of the ear. But again, because it's on a daily basis, pretty much, is as we go along, if we have problems, only that area will manifest. So stimulation of an ear point does not affect the organ directly, but it all the body part directly. So if we put a point, we put a needle on the wrist point, it's not going to affect the wrist. It's going to affect the part of the brain that correspond to the wrist. So message is going to go to the brain and back down to the organ or to the body part. Yeah. but because it's going to use a spinothalamic tract nothing. Okay, this is the inverted fetus that Nogier. This is one of the book of Dr. Nogier. That's why he has the idea of the ear corresponded to the inverted fetus. Yeah. Therefore, the head is going to be in the lobe. Yeah. Then we will have the spine going to here, and then we have the legs over there, and then we will have the heart and the lung here, respiratory, cardiovascular, and then we'll have the abdomen here, and then we have the gynecology here. Yeah. We'll see that later. And then, so that's, I could only find it in French. I'm sure it's in English somewhere, but I don't know where. Yeah. So that to show that the ear is going to, whenever you have an indication, a pain. Yeah. So it's going to be two ways. Whenever you have, if you have a pain in your foot, the message is going to go alongside your spine, then connect to your thalamus. Yeah. And via the auricular formation is going to reach the corresponding area in the ear, and vice versa. When you treat the ear, any particular area zone in your ear is going to go, the message is going to go to the brain via the reticular formation, which is going to relay, the brain going to relay down to the organ or to the area. So that's why if an example I always tell in my classes, if you step on my foot is going to be painful, and then the message is going to go to my brain, and then to, if I look at the foot area on the ear, the point is going to be painful. So then if I needle the ear point, it's going to stop the pain in my foot. Yeah. So that's the beauty of the ear acupuncture. And I do that many times, stopping the pain right away, or at least greatly alleviating the pain. And then I will talk about, if you want to increase the range of motion, there is something else to do. So that's how the ear corresponds directly to the brain, and directly then from the brain to the body part. So we affect the brain. We regulate the center of the organ of the body part in the brain when we do auriculotherapy. Yeah? That's why it's so efficient. Now I give you some pictures of different nerves. There are many, actually in the body areas that are the most innervated. So you have different colors here. You have temporal nerve, which is in red. We have lesser occipital nerve in blue. We have the auricular brain. Vagus nerve is very important because it's going to irrigate the conchae, which is called the Simba concha, cavum concha, where we have all the abdomen, organs in the abdomen and the organ in the chest. Yeah. So vagus nerve is going to be important irrigation all over this part. And then we have greater auricular nerve in orange. Then we have on the back of the ear, I don't use a lot of the posterior ear, auricular branch of the vagus nerve again, and then the lesser occipital nerve on the base and on the top. So the back of the ear, I use it according to what I learned from Dr. Nogier to increase the range of motion. So someone, for example, someone comes to your come to the clinic with, say, low back pain, okay? And they can't bend forward more than, for example, 90 degrees. They can't, they can't put their, they used to touch their feet, and now they can't for some reason. And if it was 15 years ago, maybe unlikely not to get a result in one session, but if it was fairly frequent, usually, so what we will do in that case, you will look for the low back pain in the ear. Okay? So in the low back sacrum area in the ear, we're going to needle always the most painful point or points, because sometimes you can needle more than one point. You can needle 2 or 3 in the same area because it's a zone. Yeah? So that will totally alleviate the pain or decrease the pain. On the opposite area, on the same time, when you have your sacrum or low back, and you turn on the other side, the exact opposite point on the back, and you needle that one, at the same time as you ask the person to move their back, if it was a low back, is going to, boom, increase his range of motion right away. Okay? You do it for the shoulder, you do it for, it really unlocks the range of motion, especially if it was if it's acute. Yeah? It always works. Yeah. So using the ear for treatment, only one ear at a time. I see sometimes even students in the clinics, they used to ear. I don't know why. Yeah. Nobody, when I was at school in San Diego, because I did my schooling like 20 some years ago in San Diego, PCOM, I remember our teacher was very adamant. She was saying only one ear. Yeah. And so I don't know where these two ears come from. And then both of my teachers, Dr. Nogier and Dr. Wolf, they also say only one ear at a time. And Dr. Nogier further explained that if you use both ears, it take out take out from your treatment. It diminishes the validity of your treatment. It has less action. Okay, so less action if you treat both ears at the same time, because he says it's too much information from the brain. So just one at a time. So one session, one ear, for example, 1 week, like here we are used to treating people once a week. It's very common. So one ear, one session, the next session, the other ear. So one ear at a time to have better effect. Start with the ear again. So some people have different opinion. Maybe you have a different opinion if you do auricular already. Some people say only use the dominant ear. Some people say if anything below the neck is going to be the contralateral, above it's ipsilateral. I don't go by those details. I just look at, and as Dr. Nogi explained, which ear has the most indication. Okay? And Nadia, Dr. Wolf, she usually starts with the dominant ear, but if your non-dominant ear has more indications, more visual indications, it's mostly likely the one that you need to treat. Or also, if there is not too many visual indications, but it has more pain. So we are going to choose the ear that has the most problem, either most painful points or most indications. And then we'll alternate in the next session. So the whatever we see in the ear, it may represent the problem at the moment or something in the past. Sometimes I see, like blood vessel going across the sacrum or the lumbar area. So I ask, do you have a low back pain? And they say, no, I do not have a low back pain. Have you had low back pain in the past? Yes, and sometimes they say, oh, no, and I don't remember. And sometimes the session next week, I say, oh, yeah, I remember. You asked me if I had you have had low back pain. Yes, I had the injury, whatever, like 20, 30 years ago. Yeah, because the body does not lie. We just have to learn how to read. Yeah, the body always gives us all the indication we need. So it's very important that we start developing the visual diagnosis. Yeah? So again, they may so those indications in your ear, they may represent a problem that is so an important problem in the past. Yeah. So for example, you had a fracture, it's an important problem. So it may still show now. If you say you fractured your tibia, yeah, it must still show. Or if it's in the present, even if it's less important, you have a strain, for example, it's still going to show, yeah, or sprain. So if I had a fracture 20 years prior, the point may be still painful, or if it has impacted your health in general. In that case, it might still be painful, even though it's not a problem now. Yeah. So it can be either or. Yeah. So in that case, we always ask the patient, did you have an injury? Did you have an experience of that particular pain earlier? And sure enough, they may have forgotten, but sure, you can't go wrong. Yeah. So because he said the ear always informs prior to consciousness, the ear informs us that whatever pathology in preparation, it is said that it takes, I think, 7 years it takes 7 years, I think it's 7 or 3, I think it's 7 years. Yeah, I think it's 7 years for a cancer to grow by 1 centimeter, which is less than 1 inch, because 1 inch is 2.54 centimeters. So to grow 1 centimeter, apparently it takes 7 years. So it means long ago, the cancer has started developing that we were unaware of. So now, then we should have markings in the ear already to see when something starts developing. Yep. So that's one of the big advantages of the auriculotherapy, looking at what is in the development that may not manifest. Yeah. And in that case, if we see something will be in the breast, if it's a breast cancer or tumor, then we should send to their doctor for, I suspect this and that, and then they can check. They can have it checked by their medical practitioner. So if they are under analgesic anti-inflammatory, as I mentioned before, the pain is felt in the joint but not in the ears. It's going to be a false negative. So when they come to see us, if they are on meds, then it's not going to be really relevant to do the diagnosis by pain. We need to tell them to come at a moment like before they take their meds, for example. And so local pain versus referred pain. Local pain, if it's purely mechanical, then as mentioned earlier, you are going to needle the point on the anterior ear to eliminate the pain and the corresponding point on the posterior ear to increase the range of motion. But maybe our back pain is not from the lower back, from the mechanical problems. Maybe it's an organ issue. Maybe it's come from your genital area, yeah. And so in that case, if the pain has a different origin, there will not be much improvement if you only use a local point, and because it's not the root cause is not there, yeah. So the pain only will go away when we address the cause, and that's when my teacher, Dr. Volt, is excellent at finding the cause of the problem in the ear itself, yeah. And so she devised the tool called causative auricular diagnosis, which she teaches regularly. So I go to France, but I used to go to France 4 times a year for the last maybe 4 or 5 years to follow her because she's excellent. And she does acupuncture, body acupuncture to treat the issue. And so that's why sometimes because if they have a pain in the low back, yeah, that comes a prostate cancer, for example. How good are we if we just treat the pain in the low back from the ear, yeah? If we reduce the pain, it's no better than giving a Tylenol, yeah? So that's why the pain, the body is going to show pain when something is off, yeah? And sometimes it can be something severe because the low back, and they can come with a knee problem that maybe it's a prostate issue. Why? Because they have the same innervations. So I remember when I started studying with her, she's one of those practitioners I followed in her before starting school, before I came to the US to go to John Pickham. I followed her in her practice. She was already very successful. She was seeing like 100 people per day, running around, and I was helping her for 2 weeks, running around all over the place. Yeah? And but people were coming from all over Europe to see her, and still nowadays she's coming from different countries to go to her practice in Paris. They come from Middle East, they come from USA, so she has those very famous politicians, academicians, actors, whatever. So that's her clientele nowadays. So she said, no, I cannot have you I cannot train you particularly in my office anymore because those people, they want privacy. Okay, so I had my turn when she was seeing not so many famous people. So, but then she trains medical doctors in various fields. She teaches at the medical university in one of medical university in Paris. She teaches acupuncture and ear diagnosis, so to different medical professions. So she has gynecologist, she has ophthalmologist, she had also, of course, general MDs, whatever, you name it. So they are the people that go to the seminars where I go to as well. And so that's to talk about, she's the expert in finding the root of the problem from the ear directly, and then we are going to treat with body acupuncture. So again, the point was that if somebody has a pain, it's not a good idea just to treat the pain only. We need to figure out where it comes from, because if it's for prostate cancer, it can manifest in the low back, it can manifest in the knee, and again, any area that belong to the same innervation. So now, time is flying by, so let's move on. Anatomical structures, I don't know among the people who are taking the class, some may be very advanced of you, so you already know the structures, you already know the points. Some may be beginners, so I just gave you here If you have the CAM book or the Shanghai textbook, you know, the mapping is all there. So in helix, which is the outer part, the most, you know, the most outer part all around here, that going to indicate our constitution and our Jing, or immune system. So any marks is going to indicate as the immune system is compromised or has been compromised in the past. Yeah. The lobe, we said, is going to be all the face and sensory orifices. So you have the tongue, you have the ears, you have the nose, and so on, and eyes. On the antelix, so antelix is the, you know, this part here, which is called antihelix or antehelix. Yeah, on the crest, it's a protrusion, and then it's going to start with antelix. We'll have the spine from the cervicals all the way up to the sacrum, and then it divided into two. Oh, what's happening here? It divides. No, I want to go back. Okay. Then antelix, it's a spine, and then it's separated into two branches. One is going to be called the superior antihelix crus, where we will have all the legs, yeah, starting from the hip all the way down to the feet and the toes. And then the inferior part, again, according to different systems, I'm talking about the Chinese system, inferior part is going to be the buttock and the sciatic nerve we found, and all the way to the end, which is going to be the sympathetic nerve. And on the tragus, which is this little thing in here, different maps depending. For the Chinese map is going to be, you have the thirst, you have the hunger, you have the nose, and so on. And then on Nogier is more, and other people is going to be more the corpus callosum. Anything has to do with the division of the brain. Antitragus, which is this the little bump here, they're going to be the brain structures with different, all the different brain structures, thalamus, hypothalamus, the cortex, and so on. Scapha, which is a depression. Inside here, we have the whole limb, which goes from the clavicle all the way to the fingers. We'll have the shoulder, elbow. So I can show you later on the real ears. Triangular fossa, which is the depression between the two branches where the spine divided into a Y inside. That's all the internal genitalia. So for women, it's going to be everything linked to gynecology, to menstruation, to infertility as well. Yeah, anything linked to the gyneco. And in men, of course, so a different mapping. The prostate, for some mapping, it's inside the what we call the Simba concha. And then but some mappings, it's also in the triangle. You can also check in the triangular fossa, even for men, even though the Chinese don't put it there. And so Simba concha or superior concha, we have all the abdominal organs. So we have the duodenum, small intestine, large intestine, and we have the UB. We have the prostate for the Chinese mapping. We have the UB, the kidney, the liver, and the gallbladder. So the gallbladder is said to be on the right ear only because the gallbladder organ is on the right. And then the same side on the left ear is supposed to be the pancreas, because the pancreas is on the left side. And in the cavum concha, also called inferior concha, that's going to be the chest. So we have the lungs, we have the heart, and we have the bronchi and the trachea. And then we have a little bit more. I'll show you when we have the map. So these are the map I give for exam when we have exams in the classroom. I give them a blank map, and again now we that to fill out. So that's going to be the helix. I don't know if you see my cursor, by the way. Anyhow, so we'll look at the cursor later. So then these are, when I go to seminars, when you go to seminars or at school, I ask them to buy ears of different types of ears. These are the one I use. And so if you go to Nogier, Dr. Nogier wants to have your ears because he's going to correct. So we have pins, the pins we use for the clothes. And then we put our ears according to where we think the point is in the direction, because we call this a vector for needling, either perpendicular or oblique or whatever, and it comes and it corrects alongside. Yeah? So these are my rubber ears I use. And then, again, it's very good to learn and practice. Now, I put also a couple of pictures of the tools. What do we need? Because usually we are going to do acupuncture needle, whatever one you use, in the ear, yeah, during the treatment. And then we take out the needles and then we let them go home, usually with either seeds or little pellets. Yeah, the seeds are going to be those ones, the Vaccaria seeds, you all know, and the pellets are usually the Japanese one we see little gold ones on the bottom of the screen. So the other one are embedded, I believe, the blue, I think it's probably Vaccaria seeds as well, and on the right is like embedded needles. So again, some people like the pellets. I do not like the pellet because they are too big most of the time. Yeah. They're too thick, and so if it's a zone, it's okay, but if it's for a precise point, it's not good enough, in my opinion. So they are more gentle, so they're better for sensitive skin or people or children because they do not penetrate through. So now I usually use intradermal needles because I want my treatment to have a better effect. So that's why I'd like to have something that really goes through. So that the ASP, semi-permanent needle, A for aiguille, which means needles in French, S for semi, same thing, and P for permanent. So they either stainless steel, gold, or platinum. They are I usually use the gold because gold is number one, they look good. Yeah, they look nice. They look like, like earrings. And also gold is a metal that never change over time. You can find gold from 3,000 years ago. It's not been corrupted. It's not been tainted. So gold is apparently the best metal you can put in your ear. So it's most potent because it's because it's more painful on insertion, even though there is a trick to prevent too much pain. But the advantage is they can be continue stimulating during the week when people have them. So we usually keep them for severe cases, very chronic case, a stubborn case, are difficult to go away, or people that can really stand the pain of the penetration of the ASP. But especially for severe problems, and they work more effectively. So advantage, they have a little insertion tube, yeah. So for some of you that are not familiar, yeah, that is the ASP. So they come into a package, I believe, of 10 or 8 or 10, and then it's easy. You just have to press, and this little gold needle will go in the skin, and then this is a magnet. So what we can do, we can give. So there are two ways, because what's important during the week, if they have, for example, they have a pain in the low back, then when they have a pain, they keep pressing on the point, yeah, with their finger, or which is going to be painful, or they keep using the magnet. They just go clockwise, counterclockwise with the magnet without having to press on the point. So that's an advantage of the ASP with a little sting. Yeah. So best for severe case or chronic and stubborn, and it has supplemental tape. Now it has a little tape as well that is going to this. You can cover for people who don't want to show that they have a little earrings, or if we want to make sure they are they don't fall so fast. Pionex, several sizes. So these are the Pionex. There's different colors here. So those colors are going, these are the thinnest, they're the yellow and different colors. So they're according to the little embedded needle in the center. So again, the color is according to the length of the needle, how deep we want to go or not. For very, very sensitive people, this is the thinnest one, the smallest one. And this is also embedded needle that need to be covered by a tape also. In that case, this one are better for a slanted insertion when we're going to go oblique, yeah, or transverse, yeah. So that's the best one for this case. And advantage, you have a tape and other brand that I just show now. And then how do we probe? You can have the regular tool that most people have. This one is what Dr. Nogier uses, and the advantage of this one, this is a spring. So you can have different, if you press all the way through, it gives you 250 grams of pressure, which is about half pound of pressure. Yeah. So in that case, with the spring, the advantage is you can decide how much pressure you can put, which is easier to control as opposed to the one we usually use in our clinic, the ear probe. Then that takes us to now. I wanted to so Jeffrey, we are going to start looking at the ears, yeah. And I'm going to use my cursor. So I selected ears of some of my patients. So remember, I can just go over the areas. Everybody knows what the helix is. We are going to do the root of the helix here, all the data. And we said the helix is going to show the immune system. Any mark, anything when we immune system is compromised, yeah. And this also the let me show on the other ear. So we are going to look for deformation on the ear, and I will show you people who have autoimmune disease. Is going to be easy to see on the helix. I have a couple of cases of people who have autoimmune, or the gene is very compromised, so the helix is going to change size. It's going to be thick on the part and it's going to narrow down later on. Yeah. So if I don't want to scare them, I start by asking, is there anybody in your family that has immune system problem? Yeah. Instead of, I'm not asking, do you have immune system issue? Yeah. Because I never look at the chart before I take patient in. Yeah. Because I want to learn. I want to refine my diagnosis skills. So I don't want to know anything when they come to see me. So I look at the ear, I take the picture, and I start asking questions. Do you have this? Do you have that? That's how I know how good I'm going to be in 50 years. Well, if I get that long, right? So now, so we can see, and then this was we can see the lobe that hold that's where we put the earring, usually eye area. So the lobe is going to be the all the face, yeah. This is anti-tragus, where we have all the brain structures. This is going to be the anti-helix. So cervical, that's going to start here. It's going to be to the cervicals, and then we have the thoracic, which we already know she must have. There is something in the thoracic area, so probably. So we can ask, do you have pain in your in your mid spine? It can also be the breast if it's more on the side here, but we don't see any scar, we don't see any tumor, any swelling, so it should not be the breast. So it's going to be something in the thoracic area. And then it's going to be the lumbosacral. So the Chinese, they say divide by 3. The first third cervicals, and then second thoracic, and then we are going to have lumbosacral. And then we have the superior anti-helix crus is going to be the legs from the hip all the way to the feet. And then in the Chinese map, we're going to have the buttocks, the ischium, the sciatic nerve here. In Dr. Nogier is going to be your coccyx is going to be on the bottom there, and that's why it was people who came for sciatica. The lady I told you about that had cauterization, that was here. So this your L5S1 area. Everybody was cauterized here. That's why Dr. Nogier Paul had the idea that this was L5S1. Yeah. So again, if you don't want to use the L5S1 here, Chinese map, you always use both. Why not? Yeah. And you can usually will find, I think the thing is, one map is going to show us where the root is. The other one is going to tell us where the manifestation is. That's why we have some discrepancies. So then we said in the scapha, if you scaphoid fossa, the scapha, then we have the clavicle all the way to the shoulder, the elbow, the wrist, and all the way to the fingers. And now we have the depression, so that was the tragus. Again, the Chinese map has the nose, the hunger point, the source point, and so on. And Dr. Nogier has the corpus callosum here. So triangular fossa here, we have all the gynecology, and that's where the Shenmen is located as well, anxiety, yeah, regulate your parasympathetic nervous system. And then here we have the whole abdomen. So it's going to start, remember, if we start at we have the diaphragm here, which is the doctorology called the point zero, which is the diaphragm. And then we have the mouth, and then we have the esophagus, and we have the cardia and the stomach, which are all around here. And then we have the duodenum, small intestine, large intestine, all the way there. And then prostate in the Chinese map. And then we go to the UB, to the kidneys, to the liver, and the gallbladder. Yeah? And then here we are going to have the chest, we have the lung. And so the heart is going to be usually in the center of your fossa, and the lung is going to be all around, and then we have the trachea and the bronchia here. And then in here, we also have the endocrine system, the ovaries, the gonads in that part. Yeah. And then we will have more eye. We have 3 eye points, one here, and then we have another eye point here, another eye point here. So if I look at this, we can see that young lady, that she was 26 or something, we can see already, without knowing anything, ask a question, does she have a pain in her thoracic area? Now, we have a big liver gallbladder. So we have to ask question, and see, this is going to be, is it the stomach, is it the duodenum, because it's at the limit, but we know we have digestive issues. And then it's going to be red all the way to the large intestine. So we have something going on, we know, in the digestion. Yeah. And then we probably suspect she has something going on with her menses. Yeah? Otherwise, unless she's menstruating the day she comes, in which case it tendency to be red. Then she has blood vessel going over here. So it might be, I will ask, is it a hip issue? Can be the hip, huh? Because the hip and the knee are going to be close in that area. We start seeing something going around here. So that will be low back sacrum. Yeah. So again, does she have a sacrum pain and so on? This is going to be the allergy area. It can be the wrist, by the way, because sometimes you have several systems overlapping with one another. So it can be the wrist. It can be the allergy or toxicity area. It's going to be all red usually. So ask question, do you have allergy? And yes, she has allergies. And then we have that so when she came in, she had anxiety. She told me she had cholecystitis. And then what else? Anxiety, and she had shortness of breath. You can see already that's a little bit not very pronounced, but you have a little bit red here. And then so we can see maybe if we want to compare with the other ear, yeah. Then again the gynecology showing. She also has again the sacrum showing. She also has again the intestine showing. She also has the again the lung and so the respiratory system. So without knowing anything, we can already figure that out. Yeah. The next slide. Yeah. The next slide is let me see. I have my notes next to me. Is a gentleman. Okay, no, this one, the one above. Yeah, that one. So that man is about 50 years old. So if we don't know anything, we can see we have a problem in the lobe. Okay, again, so according to Dr. Noges, it's psychological issues here. It's called psychic traumas. It can be. We say if the lobe is red, it can be high blood pressure. We can see how about is here. If we look at he has one side. Is not much different except this side. See, again, is that this side bigger or is because my picture is closer? Yeah. So I think is here where both, if we take the picture on with the same size, there is no big difference in the size of the helix. But then we can see there's something going on in the brain here, right? So you can see this red mark here, and then apparently possibly a a brown dot here, and then on the right here it also has at the brain stem here he has a crack. So there's something going on in the brain. He may have neck pain, right? Because that's the beginning of the cervicals, yeah. And again showing the neck here, and then we can see again this part can either be the allergies. We say the wrist. It can be also insomnia, because insomnia is the same as the wrist, yeah. So I ask, if it's not wrist issue, do you sleep well? No. Okay, then there will be the insomnia showing up here. Yeah, and then something also in the genitals, and then we have again something in the breathing difficulties. We have a vein here, so I think we still see the vein here. So we have something from the liver, gallbladder, going to the diaphragm. If we see the vein going all the way through here, it's usually acid reflux. I think I have other people. So this person developed Parkinson, and we can see here many picture, because he has immune system compromised, because it doesn't show here, but he has those little brown spots, and this is very painful. So that's the reticular formation area. So anybody that's immune system compromised, we want to treat the apex, to treat the reticular formation. That's 1 and 2. One is going to be in line with your secondary one there, and another one in line with this part here. So reticular formation is going to be that, and the apex. And then the tonsils. In the Chinese mapping, we learned the tonsils are here, but Dr. Wolf, she has a tonsil here and there. So whenever this area has brown spots, that's immune system compromised. So to prevent the immune system to be further compromised, we are always going to needle or put ASP or Pionex in the apex. Reticular formation number 1 or 2. Number 2, I think number 1, and then the tonsil 1 and tonsil 2, especially if they are reactive. If they are not reactive, forget it. If they are reactive, we treat. Yeah. And again, he had low back pain when he came, and he had a shoulder issue, very stiff neck problem. Of course, neck is very stiff from the Parkinson, and very tight upper chest. And he also had concussion as 8 years old. So again, that maybe it's either this part or that part. Yeah. And then the next slide. Yeah, you got it. The next slide is my slide 29 is, where is my slide 29? 29. Slide 29 is a 50-year-old gentleman. Oh, we looking at the time here. We are okay. So it's so we can see now that should be acid reflux. Yes, we should see. He has that's a diaphragm. Yeah. So and when you can see, it's connected to those little blood vessels. They are connected to the esophagus. Yeah. And they go to like here to the intestine. So and it goes to the stomach. So that question to ask: do you have acid reflux? Or maybe not acid, but reflux. Yeah. And then again, we can see something in the cervical going on. Now, this is probably thoracic lumbar, but it's not on the spine. So on the spine is going to be the vertebrae. So in that case, is it the muscle? Is it the paravertebral muscle? Sometimes paravertebral, sometimes they show here, sometimes they show on the inside the wall of your conchae here. So I check both. I always check both this part, and which one is reactive. Then I'm going to needle. So now we have we have the sacrum here, and then we have this blood vessel. Is going to go gynecology again, and we have it here very pretty clear. Yeah, inside so there's something going on with the genital. Is going over maybe the hip. Yeah, and the sacrum here all the way to the area. Is it the wrist? Is it the allergies? So then we were going to ask questions. So he came with cramps in the upper thigh, yeah, which is going to be in that area here, right? Upper leg. upper side, in the calves as well. So that's going to be on the leg here. And he also had allergies. Yeah, he was on allergy medication. So again, that's, it doesn't, as I say, the ear doesn't lie. You have vessel, you have a red spot, that's going to be allergy. He didn't tell me he had allergy, but when I asked, he said yes. And he had asthma, and you can see the lung is red here too. And he had heartburn, yeah, so that's your reflux, yeah. And he had also sleep issues, again, that can be here. Yeah? And so now the next slide. Next slide, slide 30, it's a lady. Yeah, she's my little lady. She's 94. My little lady. She is very faithful. She comes every week. She takes the bus. And she comes to me every week, and every week she says, I feel much better. Yeah. But in fact, because she's slanted, she number one, she's slanted to the left side because she has a left leg that is more open, so the foot turned to the left, open to the left, and so does the hip too. And then she was hunched over, but now she's straighter. And I tell you, I should have taken a picture of her back, of her neck, because after 2 sessions she's straighter. Yeah, and she's still slanted to the left, as at the leg, but less on the spine. And of course, I treat the ear and I treat her body. So of course, she has hearing, so we already know that she must have hearing difficulties. Yeah, and then she has a red spot here. So again, is it the heart or is it the lung? But she has depression. By the way, she's on meds for depression. So she also has some redness in the lung area, stomach area, digestive issues. Again, some more digestive issues here. She has again, you can see lower back, sacrum. Probably that's maybe the knee right in there. Again, gyneco anxiety can be either the gyneco or the Shenman. And same thing here again. So now she has so again, anxiety, look at Shenman, but then something, and she doesn't remember anything from her period. I asked the history, she doesn't know anything, she don't have any information. But we have the low back pain here and we have the hip. Yeah? And in fact, she said she said she had the hip pain. Yeah? So, and in fact, so let's go to the next slide. Whoops, yeah, oh, yeah. That young woman, she is 27, yeah. So number one, she has a lot of piercing, which is not necessarily a good idea, especially the piercing. If the piercing if they are not made of gold, is a problem, because other metals are going to leak toxicity. So I ask them, ask if somebody has to give you a gift, ask for, ask for gold, yeah, piercing. But then it's not a good idea in her case. Why? Especially look at, she had a big inflammation here. So this one should go. She has another big, and that's external genitalia, by the way. And then another one here that can be straddling the allergy area, is straddling the low back. She has a big inflammation. So I say this one, at least they have to go. I say you don't have to take them all at once, because it's traumatic apparently for people to take their piercing away. Yeah. But last week she came back and she took that one off. She took that one off. So she said to me, okay, maybe the next time she will take the one, at least she has to start with the one that's creating big inflammation, because there is no, we cannot treat any chronic condition. No chronic condition is going to evolve, get better, unless we take out the toxicity. And the toxicity in the ear starts with a bad metal we put in the ear and a lot of piercing. Yeah? So, and then, so she had sleep disorders, again, that could be in that area. She has intestinal disorders, and she had a big PTSD, which is not, I think that would be that what I would see the PTSD, which I am treating her for at the moment. Yeah. She had big migraine headaches, so we don't know. So possibly, is it linked to the cervicals? We haven't really addressed that yet, but we can see that so it's something in the respiratory system here, because that's going to be your trachea, your bronchi, and then we have so the liver going to the diaphragm. So probably again we have some reflux, which she does have. Yeah. And okay, let's move to another slide if we want to cover more. Where is my next slide? Oh, that one. Okay, so that lady, she's 84. So now we can see, of course, she took off her earring. That was the first session. She took off her earring at the second session already. And we can see now, I think that's a deformity of you can see this one is much bigger here, and this one, and she has pancreatitis, from 50 years ago, and in fact, she has a lot, of course, digestive issues. You can see the reflux. It's not very easy because the abdominal area is covered, but you can see she has low back pain, she has problems sleeping, she has a hip problem, she has a thoracic pain problem, and then she has, again, digestive disorder. You can see this here. There's going to be small intestine area here, there's going to be large intestine, and in fact, she has the Whipple procedure done, meaning taking part of her pancreas, bile duct, and the gallbladder. And last week she was oozing pus, so she goes to hospital frequently. She's oozing pus in her stomach. I think next time I'm going to ask if I can see this, because she has a huge, her abdomen is covered with bandages. So I'm going to ask if I can have a look at what's going on, what they are doing there. The next slide. Okay, so now we can see, right? Acid reflux, very big time. You don't even ask to, you don't even ask to ask, yeah? Big time acid reflux, big time stomach, digestive issues, big time sacrum, and again, is a lot of anxiety which she's having at the moment, possibly genital thing. And then again, he's going to have the sacrum, the low back pain, which he does have. Again, the sleep disorders. Yeah, that's going to be the high blood. It's not very, very bad, but it's a high blood pressure here. Yeah, and then the next slide, we have I think 78-year-old lady. Again, lot of her case was a lot, of course, beside the tinnitus. Again, you can see the reflux again, the stomach issue. We can see again the gyneco, which she had the hysterectomy, in fact. And then she has very difficulty sleeping. That I see in my case. That's where I would look at first. Yeah, I'm sure there are other areas for insomnia, but that's the first one I know. And then we have this person. Now we have a real deformity, right? We can look at the left ear. She's very, very sick here, and that goes narrow down here. And then this one is different. So this person has kidney failure. She's last stage. In fact, she's on a waiting list for the transplant of the kidney in May, I think. So with acupuncture, I have not been able to reverse. She has polycystic kidney disease, and we have not been able to reverse that. But for the 3 years she has seen me, she never had dialysis. Yeah, so because she didn't want to go dialysis, she wants to work every day. So no dialysis, and her nephrologist is very, very surprised. Say, how come she doesn't have any symptom of dialysis? She doesn't have anything. So we are maintaining her until she goes for the transplant, and hopefully when she gets ultrasound, maybe the cysts have reduced. Who knows? Yeah. So again, that's a very big, important case of deformity. Okay, and then which I just want to go to the bottom of my slide, and because we are nearing the end of time, right, Mr. Jeffrey? And then picture number what? Number 36. Ah, yeah. So that again, he had a wrist problem playing tennis. And then, of course, he has a low back, sacrum here, probably, again, allergy. He has allergy, so he's on allergy medication. He was, because I haven't seen him in a while. And then with same thing, we have, so lately what I learned, he has a prostate enlargement. So again, the Chinese are going to see the prostate on the bottom of your angle of Simba concha, but also it can also be found in what we call the internal genitals here on the bottom somewhere. Yeah. And again, so that's you can see all the gyneco, his genital area is going to be linked. He has a vein going all the way and probably going to, that would be the bladder. Yeah. And of course, the prostate is pushing on the bladder. He has problem urinating. And then it's also going to be linked to the allergy area or the toxic area. It can be either allergic or toxic. So in this case, it's probably something toxic. And in fact, because I do allergy treatment too, and I found out he's taking stuff that he should not take, yeah, that are toxic to his body. Okay, so because he goes to the internet and then he self-medicates, so, and some product he's taking are not good at all. Okay, next slide is, who is, oh yes, that's a young man. He has a lot of issues. He's very, very depressed. He doesn't work, so he's immunocompromised. You can see reticular formation number 1. And he was not sure if he had the COVID or not, because he had pneumonia for sure, yeah. So we have here a big, that's chronic, that's something in the, it could be genitals, he had herpes, yeah. That's going to be more probably the low back sacrum. He has something going on. He has a lot of allergies. We can see here he's sleep deprived, and he has again a lot of respiratory issues that we can see here, also less visible in here. And then this is a young woman. She's around 40. This picture was taken. Yeah, she had a breast cancer, and so the breast is going to be here. So I think. What I should have done here is take a picture from the side, because there should be some indication, because that's going to be the area of the breast, and it's usually there could be a tumefaction, there'll be a nodules. Cancer, usually tumors, they are going to be shown on the ear as nodules, as liquor, yeah. And so I see she has liver, gallbladder issues, and possibly reflux, digestive issues, because this is the esophagus all the way to the stomach. Again, possibly the lung here. And then we have, let's see, we have, so allergy, in fact, she has Lyme disease. So I think that will be the toxic area, which we showed here. And then big veins going all the way to the uterus. And she had, so she had, in fact, afterward, when I saw her, she had all her organs, but she was due for double mastectomy and taking the ovaries to prevent the further metastasis of the cancer. Yeah, and we can see here. You can see in this ear here. You can see here, especially in this ear. These are intestinal parasites, big time. I have about 80 to 85% of my patients that have intestinal parasites. The first thing we do, we clean the parasite, because if we don't clean the parasite, the chronic problem is never going to change. So that's an indication, because now it's really indicative. It's in the abdomen, and yeah, we did parasite testing, and it does have parasites. And then it's invading the respiratory disorder, and sometimes is genital. So when you see those little black dots here, it means it's intestinal parasites invading the gynecology system, the genital system, and the respiratory system. So we're not going to get any improvement until we clean the parasite, and it may take more than 1 month. Okay, so he's been on a formula. He's been, I think, taking 1 month already. This was, I think, the first session. And he has tested negative for the parasite we tested. Has been tested negative so far. So this is I want for some of you who are not familiar with what it looks like when you leave needles in the ear. These are the little tapes over the ASP. Yeah, that's somebody I was treating from insomnia. You can see the area here. And then these are some people, they want to keep their ASP. So if you leave the ASP in the open, that's what it looks like. So some people want to keep it this way, some people they want to cover. And then this is a Pionex. Yeah. So again, you can put the tape over if they want to, and the Pionex. So that's it. So boom, it was fast, right? Non-stop talking.
Wow.
Wow. Jeffrey, I don't think we have time for question, right? Because we already gone over time.
Yeah, so I think that we've probably gone a little bit past our time tonight. So I think what we should do is, if it's possible, I can send you the questions after the webinar. And if you maybe, in the next couple of weeks can get them over to me, I can post them on our blog and then share that along with the recording. Are you okay with that?
Now, can you repeat?
I was going to say, what I can do is I can send you the questions after the webinar, and we can put them on my blog with the recording. Would you mind if I sent you the questions after the webinar?
But how do I answer then?
If you can just type them out to me, and then I'll post them on our blog along with the recording of the webinar.
Okay. If I type, I type the answer on what you send me, I send it back to you. Yes. If it doesn't take me 30 hours, yes.
It shouldn't, but take your time. So this was so much information. I hope everybody really enjoyed. We enjoyed having you, Marie-France, so thank you so much. Actually, next week on Tuesday, we are hosting Matt Callison, and it is for Huato Jiaji points and spinal offsets, a Zong Fu perspective. And then the week after that, we're going to be hosting Whitfield Reeves for another panel discussion on Ask Me Anything About Sports Acupuncture, featuring our panelists, which are going to be Chad Bong, Hillary Patzer, and Jenny Nieders. So check your email in 5 minutes for registrations for these upcoming webinars. And again, thank you, Marie-France. That was amazing. Such a great webinar. And I hope everybody has a fantastic evening.
Thank you, Jeffrey, for the opportunity. And Matt Callison was my supervisor in San Diego. He's really, very, very good. Yeah.
Well, don't miss him next Tuesday. It's going to be so much fun. And again, everyone have a great night, and we're almost at spring.
Okay. Good night, everyone. Thank you, Jeffrey.
Thank you.